Abide by the bylaws of the Wisconsin Dental Association.
Defend and abide by the bylaws of the Wisconsin Dental Association.
And to give my full support.
And to give my full support.
To the Association's missions and goals.
To the Association's missions and goals.
By the power vested in me, I hereby duly install you as President of the Wisconsin Dental Association for its 139th year by the presentation of the Presidential Badge of Honor and the passing of the gavel.
We are diverse groups of people, reaching out to others, helping each other toward a common goal of better oral health for our patients. People sometimes have asked me, why in the world would you want to become a dentist? I think for a lot of us it happened when we were little. Had to do maybe with our own hometown dentist. I know my dentist, Dr. Mike Fiddler, he's retired now, probably someplace warm and sandy too. I loved going into his office, watching him work with his patients, working with his hands, the interactions he had, the respect he had in the community. He had a comfortable lifestyle. For me, it was an easy decision. When I was in school, I'd go to his office, and those times were invaluable to me. Early in my career, I worked in a small town of Colby, Wisconsin, a couple days a week, and Dr. Jackson was there, and I learned so much from him. The one thing that I really liked about my hometown dentist too was that Wednesday afternoons he had off to play golf. And I thought, man, I'd like to have a job where I could do that. So all those things helped me become who I am today. And we all need a mentor in our lives. We need to pass that companionship and that knowledge on to our younger colleagues. Webster defines a mentor as an experienced and trusted advisor. And I challenge you, can you be that for a young colleague? Early in my career, I treated a little boy, I'll call him Danny. He's 10 years old, came into my office, very shy, didn't raise his eyes up, and he was just sad. And I did the exam in his mouth, and I was shocked at the rampant decay he had, especially his anterior teeth. And I could see that he wasn't in any physical pain, but he was in emotional pain. I'm sure he suffered all kinds of criticisms at school. Kids can be pretty cruel. So at his first restorative visit, I decided let's concentrate on his anterior teeth. So it was a long appointment, difficult. A lot of composites, MI, DLF, XYZs. They were huge. But I was pleased with the results. He came back for the second appointment, and I asked him how'd it go. Anything hurt? No. Just kind of looking down, not saying much. And then I asked him, what do the kids at school think? At that moment, that little flower bloomed. And I saw him smile for the first time. I still see his face. And I hope that everybody here has a moment like that. I'm sorry. I told myself I wasn't going to do that. But he opened his eyes and he said, "What? They think they're great," he goes. And I see that to this day. And we all need to do that for somebody because we have that power to do that. As I know, we gave him a more confident and brighter future. Okay, I spent the last few minutes, sharing some personal stories because I think we need to recapture the essence of this profession. We saw this firsthand at the Mission of Mercy in La Crosse this past summer, and we show our concern with events like that. Give Kids a Smile, the WDA Foundation, donated dental services, and the care that we simply donate in our own offices. We volunteer for school-based sealant programs and work with the local Head Start. We give of our time on United Way boards, Little League coaches, church volunteers, and scouting leaders. We are caring, unselfish, charitable professionals, and we need to tell our story. To our patients, our community, legislators, members of the administration, we need to show that the dentist, educated in the larger picture of total patient care, and as the leader of a talented team of skilled personnel, is the best way to ensure the highest quality care for our patients. This is not an easy task. There are those in government, both in Congress and state legislature, that think that less trained and less qualified individuals can solve the access problem. They think that by flooding the marketplace with dentists, that the access problem will just simply go away. If the economics of the Medicaid and Badger Care program are not improved to the level that the average dentist can at least make affordable, these solutions are only temporary. There are many issues affecting us. The downturn in the economy has many dentists rethinking their retirement. Obamacare has us nervous and scared. And if you believe Hollywood and the internet, the Mayan calendar has predicted the end of the world in 2012. Turn it off. Just turn it off. The formation of the dental therapist in Minnesota, the idea of a mid-level provider is swimming across the Mississippi, and it's knocking on our door. Proposals by the Wisconsin Dental Hygiene Association are asking for dentist oversight to be removed virtually from every clinical setting. These workforce issues are at the top of my list this next year, and I have a lot of questions. At age 55, I am the average WDA member. My 10-year age group represents 31% of WDA members, nearly a third. You add the age groups above that, it doubles. 2/3 of our membership are over the age of 50. What will the workforce look like in 10 years? How many dentists in my age group will be retired by then? I hope I am. Will there be enough dentists to take our places? What can we do to help our members, especially those in rural practices, find a successor? How is this trend going to affect our membership dues and our association to keep it running at its current level? These are things that we discuss in our committees, and we plan to discuss at our strategic planning session next March. It's through these processes that we remain visionary, and we are able to be proactive on issues rather than reactive. Now more than ever, we need to show the value of membership and have one-on-one engagement with our younger members. The conclusions of our last workforce study in 2001 told us that the number of dentists in our state were sufficient to meet current demands. But we were too concentrated in urban areas, a maldistribution. Is that true today? We have a new study due to be completed hopefully next month, and I anxiously await those results. We will analyze, discuss, debate the results, and formulate our positions on what we think the future of dentistry in Wisconsin is going to be. As you saw watching the year in review, the scope of the WDA is enormous. And I hope to demonstrate that further to your components as I travel around here. It's easy to think that all we do is fight legislative battles. True, it's a big part of what we do. But there is so much more. Mission of Mercy Project, Jewel of the Lakes, Dental Home Initiative, Public Awareness Campaign, WDA insurance programs and professional services. I can go on and on. As shown in the monthly journal, executive director updates, our website, and the emails sent directly to you. Along with the American Dental Association, we are the go-to resource for anything that you do on a day-to-day basis. Don't hesitate to ask for our help. I'm in my 4th year now as a member of the WDA's Council on Dental Practice, so-called kitchen sink of councils. Anything doing it with dentistry comes across our desk. I've had the opportunity to debate issues with dentists from all over the United States. And in listening to their issues, they're very similar to ours. Many we have already dealt with. And I have concluded that the WDA is on the cutting edge of state associations, and you should be proud to be a part of it. I know I am. I'm honored to be part of this profession and humbled that you have chosen me to represent it. I promise you my support, my willingness to hear both sides of the issue. I will serve, advocate, educate, and empower, and to paraphrase our mission statement, advance your interests by promoting professional excellence and quality health care for the public. Have a great morning, and thank you.